Good morning, everybody. This is Susan from the Fatigue Clinic. I want to talk about glutathione today. I've been working with glutathione for, almost 2 decades now. And I pull my research back out and I always read because there's more things you can learn, and then there's highlighted things you've done forgot. But here's one of my books on glutathione. And then I've got another complete box of glutathione literature. So I kind of asked myself what I wanted to look at, and I wanted to go back and I wanted to look at the basics, because sometimes the basics can help you identify areas you can use this and help people. So I've got a couple of articles we're going to go through. One is a recent advances in nutritional science, and it was recent in 2003, so I've had it for a while. But what it does is it kind of goes through, and the abstract is, I'm going to read exactly what it says to you. Glutathione deficiencies contribute to oxidative stress, which plays a key role in aging and the pathology of disease. Okay, that is what we're going to talk about this whole time, is how the lack of this glutathione in your body can open up a can of worms, and that genetically wired person can start to develop problems, including autoimmune disease. Okay, now to understand why I lose glutathione, first you need to know where it's coming from. It's coming from your liver. And when you're young, and you got all this energy, you're excreting all of this glutathione, and it's being taken into the cell and used to make energy. And that energy the cell will use to perform the duties, whether it's a liver cell, a thyroid cell, it doesn't matter. Okay, so what happens is that 85% of the glutathione that is made will be taken into the cell. The remaining part of that glutathione is used extracellularly in the pulmonary system, the lungs, hence the reason it helps with COVID-19. So there's 2 different types of glutathione. You have an oxidative glutathione, which means it's already been used, okay? And then you have a reduced glutathione, or a liposomal glutathione, and that's the one you're looking for when you're looking to supplement with glutathione. Okay, so that kind of makes sense where it comes from. Well, how do I lose it, Susan? Well, you lose it through disease, through smoking, through drinking, through lifestyle choices. You lose it through age. At the age of 20, approximately every decade, so every 10 years, we have about an 11% decrease in our ability to make glutathione. So if I have my scales, what I tell my patients, I got my scale of justice here, and these are the genetics I was given when I was born, and this is my glutathione. With time, I'm doing this. My genetics doesn't change, which means my methylation does not change. My predilection toward particular diseases does not change, but my soldiers that fought it keep diminishing. Okay, so the goal when you treat someone with functional medicine in a holistic manner is to try to balance those scales back out to where they're going to have better outcomes. So this article just kind of goes over the basics of what it is and why you need it. The glutathione, systemic protected against oxidative and free radical damage. Okay, those were like keywords in the 90s when we were in the cath lab working. If we did an angioplasty on somebody and we blew it up, we released what's called free radicals. Well, what's a free radical? Think about it like this. If I'm oxidated, I'm the rusty nail in the rain, okay? And all that stuff is released in my bloodstream when I get rid of the problem. All right, I release all this dead stuff. Well, you can just about imagine releasing dead stuff is not a good thing, especially if you don't have someone that can clean it up, mop it up, and take it out. All right, so they found out when they did this research article, and it was published in 1997. There again, this is a lineage of articles that we're talking about. Glutathione depletion leads to cell death. It's been documented in many degenerative conditions, okay? Well, where did I tell you it went? It went to the mitochondrial cell in the cell, okay? So if I'm having cell death in my pancreas, I might develop diabetes. If I'm having cellular death in my liver, I might develop cirrhosis. So it depends on where it's actually occurring, okay? Now this article goes on to say it actually incorporates vitamin C also in some of it. But it goes on to say that glutathione is the central constitution of your oxidative stress system inside the mitochondria, i.e., it's your garbage collector. I don't want to be the rusty nail. If I am the rusty nail, I need somebody to pick up all that trash and to take it away. Bind it, take it away, okay? Because if not, it's going to recirculate, okay? So we don't want it to recirculate. We can give glutathione in several ways in medicine. By tablet. It has to be the right kind. It has to be liposomal or reduced. We give a lot of it IV in the clinic that I work with. We use it almost like a prednisone pack when people start having flares. Instead of putting them on prednisone, we titrate their glutathione because it helps with inflammatory changes. That's one of the things it does, is it fights diseases and inflammatory changes. This article goes on and it talks about the blood-brain barrier and how they have found glutathione storages are low with people that have schizophrenia, Alzheimer's, Downs, autism, tardive dyskinesia. So it gets, the blood-brain barrier has an impact with this also. It also, I like the way it talks about aging. It talks about it a little differently than what I said a minute ago. This one says glutathione and aging. There's a correlation between associated glutathione depletion and in poor health, which we said that a minute ago. Lang and collaborators actually looked at 40 young subjects between 20 and 39, and their glutathione level was 17% higher than the patients between 60 and 70. Okay, that makes sense, but I have this question for you. How do I know what normal for that patient is if I didn't get a sample when they were born? How do I know they weren't born with high glutathione levels? And how do you determine what is high and what is low? You might be surprised on how those ranges pop up. My thing is, it's great. We can measure them all day long, but we know that if disease is present, we don't have enough to fight disease. So give it to them. It's not going to hurt them. Okay. So this one, they actually did looking at ways to address the depletion in the cell. What they did was they gave 15 milligrams per kilo. Okay, so a 150-pound person is approximately a 68-kilo person times 15 milligrams. That's how you get it. That's a gram. Okay, so 1 gram raised glutathione 2 to 5-fold within, it doesn't give me, I thought it gave me the time, but it didn't. But it says it raised it within 2 to 5 in most of the subjects tested. In another precursor, and a precursor would be something that comes before glutathione. Like you'll hear people talk about acetylcysteine. Oh, take acetylcysteine. You'll make glutathione. Well, not necessarily. Okay. So they didn't find giving acetylcysteine or NAC helped at all with those people. Okay. This is what the glutathione molecule looks like, if you're wondering what we're talking about. All right. This is a scientific research paper that actually took multiple research papers, and I printed this in 2013, and it looked at different diseases. Okay. So it looked at alcoholism. They tend to have very low glutathione storages. It looked at Alzheimer's, autism, cancer, all there again, low glutathione storages. Chronic fatigue syndrome, which we see a lot in our clinic. It talked about it, and it said that the role of oxidative stress in chronic fatigue syndrome is an important area for current and future research, and it suggests the using of antioxidants to manage chronic fatigue syndrome is greatly justified. So a lot of our patients are on particular antioxidants. Glutathione is one of them. Vitamin C is another one. They all go on those. Then it talks about diabetes. Remember, we talked about the pancreas a minute ago, and talks about dysregulation of glutathione and the synthesis increasingly being recognized as an early precursor to diabetes. All right. It talks about heart disease and stroke. All right. And there again, it tells us that these patients have very low glutathione storages. So in the setting of a low glutathione storage, which I know I'm going to lose through aging, I'm going to manifest diseases, which that makes sense. Also, and I don't want to get into this now because this is a completely separate lecture, glutathione can chelate and help you clean up heavy metals, which we'll get into that another day. The effect of glutathione, acetylcysteine, and lipoperoxide damage in patients with early sepsis. This is one of my passions. I worked in the hospital for a lot of times, and I was a sepsis queen. I literally had a sepsis beeper, and I had to go around and see if people were septic. This study actually looked at giving people glutathione and NAC, and it found that they had a greater survival rate when they gave those patients that. And they gave it at 70 milligrams per kilo, which averaged 150 person, it averaged at 4.7 grams, which is roughly 5 grams, which is not a lot to give. You just have to give it IV, and you don't have to give it fast or they're going to vomit all over you and go into tachycardia. But it talks about it was administered through a syringe pump, 200 milliliters over 24 hours. So they mixed that amount of medicine in 200 cc's and they gave it over a 24-hour period, which personally I would have given it a little faster, but this is not my study. And they found it was amazing. The patients were better in the morning. So there again, another reason glutathione helps with stuff like that. I laugh. We have a lot of NASH patients in our clinic, and I just found this article the other day. It was published in 2017, and it talks about the efficacy of glutathione for the treatment of non-alcoholic fatty liver disease, NASH, and a single-arm multi-center pilot study. Basically, they had 29 patients, and they all had NASH syndrome. They had elevated liver numbers, and they gave them oral glutathione, okay? So when we have a NASH patient and their liver numbers go up, we bring them in the clinic, we give them IV glutathione once a week, we use the biomat for them, and we bump up their oral glutathione. We do that for about 4 weeks, and we recheck their liver numbers. They always go down. Once they get in the normal range, we kind of cut them loose and we titrate their home dose to maintain normal levels. But there again, we've been doing this in the clinic for 10 years because it makes sense. And here's a nice research article to support what we've been doing there. Another thing I used to do was trauma, right? And we had lots of strokes and heart attacks. This looks at the first 48 hours, which is one of the most important in a stroke patient, because we start to lose not just the area of infarct, but the area surrounding it. Well, what they did with the study was they gave glutathione. And they looked at this study and they gave glutathione to these patients in massive doses along with vitamin C. And they reduced the ischemic area surrounding the stroke. That's huge. Something this easy can decrease the size of a stroke. Now, of course, that was with conventional medicine. And I'm of the thought you use all this. You use Western, functional, natural, holistic. You push it all together and you make it work for that patient, okay? But they also said supplementation with antioxidant vitamins within 12 hours of the onset of an acute stroke increase the antioxidants capacity, which means I have more to work with and to get the rusty nail worked out, okay? Reduced lipid peroxidation products, which is all the release, all the nasty stuff, and had an anti-inflammatory effect on the brain cells. So basically, glutathione is something that we need. It comes in 2 forms. You have an oxidated and liposomal. You want the liposomal or the reduced. There's several brands I like to use. Dr. Mercola's got a nice one. Research Nutritionalist has a nice one. Our Metagenic site has got a decent one. The goal is you have to absorb it. Now, if you don't have a good gut, you can't absorb it. So we got to get your gut fixed because the first place of absorption is in the cells that line the gut. They're going to take that glutathione in and they're going to move it to where it needs to be absorbed by the cell. At least 85% of it they are. So glutathione is a huge thing. We're going to continue to talk about glutathione, vitamin C. We're going to kind of work through some of these and give you some, hopefully lessons within 15 minutes that can help you start to do your own research. Remember, go to Google Scholar. That's where your research is. Don't get it off a blog. Don't get it off of, he said, she said. You're smart. You're in charge of your health. You have control. So this is a huge thing that we use in the clinic. We've used it for years. I've actually brought it to the area that I practice in. And others are starting to pick up on it, which is a good thing as long as they don't use it wrong. But stay well, stay healthy, stay inside right now. And a caveat, they're saying with COVID-19 to give glutathione because of what it does for the lungs. And remember, I told you earlier that, about 12 to 15% of it is going to go into the lung tissue. It doesn't get absorbed and go intracellular. It's extracellular. So that makes sense because it's an inflammatory thing. So once again, this is just one little lesson on glutathione. We're going to have many more to come. Stay safe, stay home, wash your hands, watch our video on Nursing 101 and COVID-19. Thanks a lot.